here with our patient who's had 4 prior procedures, and his concern is with what he feels is the unnaturally dense hairline, as well as what appears to be the poor angulation of the hairs. They appear to be growing up too perpendicular as opposed to more in an anterior direction. He also lacks some good density here, so it's a very well-defined, non-irregular hairline composed of quite a few 2, 3, and 4 hair grafts, even some 5 hair grafts. In addition, the donor area, he's got some scarring, which we're going to do some repair work on as well. He's got, fortunately, reasonable laxity, not great, but reasonable, so it should be, it should be a reasonable candidate. So what we're going to do is, was there anything you want to add to what I'm doing? I mean, what you're concerned about?
Just concerned about the unnatural look at times, and also with different lighting makes it look very unnatural, and you can see the plugginess of the way the hair was inserted in,
especially along the frontotemporal sessions.
Exactly, it catches people's eye, and it definitely draws attraction to the plugginess.
All right. The work that he had done was not bad. It's just that aesthetically it could be done better, and of course technically there's things now that we're doing that will just give him at least a moderately better result, which is basically what we're going to do. So the plan, how are we going to do that? I'm going to go ahead and do quite a few punch reductions and punch removals of some of these anterior place grafts, basically using a 1 or 1.5 millimeter punch, popping these grafts out. You can see some of these big ones here. Going to pop them out, replant them so we're not going to waste a single hair. And then I'm going to go ahead and do some further grafting within the area that was already had the removals. I'm going to do some irregularly placed 1 and 2 hair grafts, primarily 1 hair grafts, but some 2s to create some imbalance or irregularity, which will look much more natural. And then, of course, the same thing on this side. The right side seems to be a little worse than the left, maybe because more grafting was done there. So we're going to take away quite a few of these. He understands he's going to be at least somewhat thinner in the for the first 6-8 weeks, but it's obviously immediately going to be a welcome improvement. And then I'm going to do some more grafting along here, and that's basically the plan. So I've already taken his pictures. So what I'm going to do now is do a little marking out. Now, one thing I sometimes like to do is create a very subtle widow's peak.
Okay.
I don't know what you think of that, but I think in you it would actually work for you.
Sure.
So I'll just show you. It's going to be very subtle. It's going to consist of, it's not going to be like an Eddie Munster thing, but literally, 4 or 5 or 8 hairs or so, just creating a little bit of a slight point, or the suggestion of a point, I should say.
Sure.
And I also make it a little off to one side, so it's not going to be bingo. It's actually going to be off to one side, which also looks more natural. And you can see I'm putting it over a little bit to the left side. And I'm not going to make his hairline perfectly even, but basically I'm going to be doing quite a bit of removal of some of these grafts here, as well as enhancing the irregularity. You also have some in the back area, which we're going to do some punch reductions on too.
Okay.
To help you with that unnaturalness.
Terrific.
And that's it. So we can go ahead and